Hello everybody, my name is Harpreet Kaur. I am assistant professor working in Chitka University College of Nursing. Let's discuss about the continuation of yesterday's topic, which is GI system. So we have been discussing about the physical assessment, diagnostic evaluation of GI system. So let's start with the interesting topic which is known as pancreatitis. So before starting with the pancreatitis, what is pancreas basically? It is a retroperitoneal gland 12 to 15 centimeter long, 2.5 centimeter thick, lie posterior to the greater curvature of the stomach. It consists of head, body and a tail. Pancreas is made up of two types of tissue, which is known as exocrine tissue and second is known as endocrine tissue. So what is pancreatitis basically? It is an acute inflammatory process of the pancreas that result in autodigestion of the pancreas by its own enzyme, or it is a common but lethal inflammatory process associated with edema, various amount of autodigestion, fat necrosis and sometimes hemorrhage. So talking about the incidence, frequency is about 5,000 new cases per year. Mortality rate is about 10%. It is more prevalent in women and it is because of alcoholism. If we talk about women, maximum is in case of at the age group of 50 to 55 years with a history of biliary disease. So etiology and risk factors include the person who take large amount of alcohol is at risk of pancreatitis. Second is if a person is having pancreatic trauma, or if a person is having trauma, either it is blunt trauma or penetrating trauma. Third is metabolic factors such as patients having hyperlipidemia. Another factor is viral infections such as measles, mumps or HIV. Certain drugs such as corticosteroids, diuretics, oral contraceptives or NSAIDs, they are the risk factors for causing pancreatitis. Talking about the pathophysiology, so there are various factors as we have discussed earlier. So because of various reasons, the pancreatic attack can be caused. First is etiological factors such as either it is because of injury, either because of alcoholism or it is because of biliary disease. Certain factors contribute to cause injury to the pancreatic cell. It further activates the pancreas in the pancreas rather than in the intestine. It causes autodigestion of the pancreas and further gallstones travel down the common bile duct, subsequently get stuck in the ampoule of water, causes obstruction in the outflow of pancreatic juice from the pancreas into the duodenum. The backflow of these digestive juices causes lysis of pancreatitis cell and further causes pancreatic attack. So as we have discussed earlier that because of alcohol intake, it also causes pancreatic attack. So basically what does alcohol do? Alcohol increases the production of digestive enzyme in the pancreas and further increase the stimulation of CCK enzyme. It further stimulates the production of pancreatic enzyme and further causes pancreatitis. The next is the clinical manifestation of pancreatitis. The most important feature is pain. As we know that it is a predominant sign and it is because of distension of pancreas, peritoneal irritation or obstruction of the biliary tract. It is has a sudden onset, severe, deep and continuous pain is there. It is located in the upper quadrant or in the epigastric area. It radiates towards the back. It is aggregated by eating. It may be accomplished by flushing, cyanosis and dyspnea. The most important feature is, we have two features. The most important is Gray-Turner sign and second is known as Cullen sign. If we talk about the Gray-Turner sign, this means there is bluish discoloration of the frank area. If we talk about Cullen sign, there is bluish discoloration of the periumbilical area and it is because of blood stain exudate from the pancreas. The most important complication is pseudocyst. It is a collection of fluid around the pancreas and is filled with necrotic products and liquid secretion such as inflammatory exudate enzymes that has been leaked out of the damaged pancreatic duct. The most important feature is it causes abdominal pain, epigastric mass, nausea, vomiting and anorexia. Next is, if we talk about the treatment of pseudocyst, we have three different surgical procedures. First is known as cystogastrostomy, second is known as cystogenostomy, third is known as cystduodenostomy. The second most important complication is known as pancreatic abscess. It is a fluid containing cavity which result from the excessive necrosis of the pancreas. The most important feature is it causes abdominal pain, high fever and leukocytosis. The treatment for this is we go for surgical drainage to prevent sepsis. That's for today's topic. We will discuss the management in the further classes. Thank you so much.